My name is Denis. I'm from Moscow. I'm a radiation oncologist. I work in some different clinics, but one of the most important for me place of work is Euro-Onco. It's a private oncological clinic, even net of clinics. The second clinic is in St. Petersburg, the third in Krasnodar, and we will spread all over the Russia, I hope, in a few years. As I told, my work is radiation oncology, and I love this method. I love this part of medicine very much. I think it can do something mysterious even mysterious things, some kind of wonder, and we can see it today in reports of your colleagues. I'm glad very much to be in your country, to be in your city, to be in your hospital, and thank you very much for this invitation. It is a wonderful experience. It's very, very interesting. It's not my first time in Proton Center, but I think your center is one of the most wonderful between the centers I've already seen. So you do the great work. It's very impressive that you stay in the flow of evidence-based medicine. I've seen it here because sometimes I see people who have got wonderful technologies, but they don't know how to use it to help our patients. And sometimes I see that technology is the main thing, and doctors' intelligence is the last part. So somebody thinks that the machine will treat patients without doctor, but I see that your doctors are professionals, extra class professionals. They know their themes very, very sophisticatedly, I think. So it's a lot of good emotions. If tell about communication between our countries, I think there are two ways. At first, communication is good itself, and scientific community all over the world, it is necessary for it to communicate, to give opinions, to give science, to give results, to do the best we can in future. The second part is the political situation all over the world. There are different parts of the world, and not of them are friendly to each other. So if our scientists, our doctors, our patients were orientated, I don't know if there is such a word, to Europe, to the USA, and less to the Asia region, even Korea or Japan. Our future, I think, will give us some chance to go closer to each other, and I think sometimes we are starting to become more interested in you. I hope it's not only one-way process. There are patients in Russia who don't like to get treatment in Russia, so maybe India or Arab region can interest them to decide to get treatment here. I think that treatment in Europe, treatment in USA especially, is more expensive, surely. We've got some recent technologies in Russia. We've got 2 Proton centers with varying equipment. We've got, for example, high-pack, different kinds of surgery, robotic surgery, some equipment, some sophisticated equipment for radiation therapy, but there will maybe some problems. For example, with getting of new equipment because of political complications. So I think that this interest to Indian doctors, Indian professionals, Indian healthcare providers will grow. By now, I didn't think about the algorithm and mechanism of such communication. I think emotions and some expressions need to become calm, and then surely with help of Ludmila, we will think how to communicate, how to try to give you some interesting patients for you. For example, one part, as the first thing, is patients with enormous liver tumors, for example. I didn't hear that there in Russia we try to treat them with radiation therapy. So I've seen some clinical cases, and they are expressive. So maybe such patients can be interested in treatment with proton beam here. So I'll think about it. It's difficult to tell you now that, okay, wait for my patients. So the first will be here in a week, for example. So thank you very much.